So my research focuses on individuals with on the autism spectrum, and so I really became interested as a child, knowing someone that has an intellectual disability, and so in college I started working with people with special needs and their families. And even though I was a biology major, I loved it, and I knew that I really wanted to have a career working with people with special needs and their families. And so I've been really lucky over the years to have the opportunity to work in this field, and social work and public health practice and policy, and also in research. So in terms of my current research projects, I have several, and they all focus on providing better supports for parents that have children with autism. And so as one example, I'm working with Dr. Wendy Shaya, who is the Director of Social Work Community Outreach Service here at the school. And we've been trying to understand more about delayed diagnoses of Black children. And so as part of that work, we've been working with a lot of partners across Baltimore City on developing a home-based program for low-income Black families in Baltimore City, and this program will be led by parents themselves. So that's been a really exciting part of our work. And then another example, I've been working on evaluating a program for Syrian refugee families in Turkey. And just like in Baltimore, I've been working with local partners in Turkey, and their input has been really valuable in trying to figure out what's the best set of supports and services that families in that location need. So whether it's in Baltimore or outside of Baltimore in different countries, I always feel like getting the input of individuals with autism, their families, their service providers, even though it takes a lot of time, I think it's worth the effort because research is so slow, but I think by engaging all those different partners, we're able to make a lot more positive inroads faster. What I really hope is that people that have autism are more fully included in our society. We label people with autism as having an autism spectrum disorder, and I think that's really unfortunate because it's a very deficits-based approach. And I think in social work we do a pretty good job of looking at people's strengths and putting the person within their environment. And I think with that lens, we can see all the valuable contributions that people with autism make. And so what I'd like to see is for families to be getting that message from the second that they get the autism diagnosis for their children, and then for them to keep getting that message from social workers and other providers as their children are growing up. So I love traveling, and I love learning about different cultures and eating different foods. So I've tried to learn several different languages. I think the last count 5, but unfortunately I'm a master of none.